Greetings, grace, and peace to you, family and friends in Christ Jesus. Thank you for joining us for this Apostolic Mentoring Program podcast. So glad to have you, and we ask you to continue to join us and to follow us for these sessions, for these teachings, and this impartation sessions that we are having on this platform. We hope and pray that you are built up, edified, encouraged, equipped, sharpened, and also provoked and challenged as we share our thoughts and our perspectives and our views concerning the word of the Lord and this current apostolic season that we are in. God is reforming his church and his people into his image and likeness. On today's broadcast, you're going to hear a presentation on mental health and wellness, and it's presented by Dr. Cindy Narasimooloo. And we hope and pray that you are blessed. If you are having a period and a season of depression, sadness, brokenness, you're having a season of grief, you're having a season of difficulty emotionally, we pray that this particular program and this session will be of great benefit to you. Also, if you are dealing with people in a mental crisis, a mental breakdown, and all kinds of chemical imbalances concerning mental sickness, we want you to listen to this session so that you can draw from some insight and wisdom and some medical wisdom as well as to what these conditions are and how to overcome them. So Dr. Cindy Narasimooloo is an expert in this subject, in this area of mental health and wellness and strength and mental rest. And we pray that as the word of God is released to you and this teaching is released to you and insight, that you would receive grace to overcome and strengthen yourself in the Lord. God bless you. Thank you for listening.
Pastor Ronald, thank you. Pastor Ralph, for the whole organizing team, for including me in this amazing work that you have pioneered. I've really enjoyed the talks thus far. Kale, is it? And your friend. It was very inspiring. I tell you what, nothing is better than a personal story. Nothing's more profound than a personal story. In fact, all education and all theology and all academics actually bows down to a personal story. So thank you for that, and thank you for pioneering ahead and doing what you're doing. Yes, so all right, so while we're talking about mental illness at an Addiction Awareness Day, that's because you don't just treat addiction. You end up treating, as you've heard from these personal testimonies, you end up treating anxiety, depression, PTSD, loneliness, rage, despair, toxic secrets, regrets, undiagnosed head trauma, untreated ADHD. And then you realize that addiction is often someone's best attempt to cope when they don't see any other way. So I start off by saying, have you ever met somebody that you thought was weird? I mean, come on, we've all seen some weird people, right? Did you call that person demented? How about mad or loony, or my husband's favorite word, doofy? Crazy, freak, retarded, nutty, brain dead, schizo, insane, all of these words. I tell you what, words hurt. You know, the first and the most important step that we need to change regarding mental illness is what we call it. So if Alice is depressed, don't call her loony Alice, call her Alice. Call her by her name, not strange, not bonkers, not a fruitcake, not odd or spazzed. That's what we use, and we need to change that terminology, and it starts with you. So when we consider what mental health is, mental health refers to our emotional, psychosocial well-being, that influences our cognition, and cognition is how we process knowledge, its perception and behavior. It encompasses three very important factors. The first being how we think, how we feel, how we act, how we react. How do we function in our daily lives? How do we relate to others? How do we maintain fulfilling relationships and make choices? How do we adapt to change? How do we cope with stress? What are the existing risks and protective factors that are in place? So when all these things are in optimum, we have a person that has a good mental health. We have a mentally well person, someone who is resilient to stress, somebody that can think clearly, someone who's productive, able to care for themselves and care for other people as well, who has the strong sense of well-being and belonging and contentment, who's flexible, with what life throws at them. Someone who's optimistic and self-confident, that has respect for others, that's empathetic, that you see they got stable relationships. And most importantly, all of this is built on a strong foundation of faith in God and finding purpose. So, with all of this in mind, we can't progress further without dealing with some of these myths regarding mental health. The first being that mentally ill people are not always violent and dangerous. In fact, they are the ones that end up being the victims most of the time. Mental illness is not a discriminatory disease. Everyone can get it. And what we're seeing now is more and more of the privileged in society are the ones that are exhibiting symptoms at a very young age. But most importantly, mental illness is not a personal weakness. It's just like diabetes or hypertension, and it has a cause that is in the brain. So when you encounter somebody who's got a mental illness, it's not because they have failed in any personal way. So mental illness is caused when the brain or part of the brain is not functioning properly. This is 80% due to genetic factors. 60% is due to trauma, 30% is due to an organic brain pathology, something like epilepsy or a tumor or a head injury, degenerative diseases, and 15% is due to drugs. And this could be illicit drugs, or it could be medically prescribed drugs. There are some drugs that you would take that would change your personality. So when the brain is not functioning optimally, your thinking is changed, your perception, emotions, all of these electrical and chemical neuronal signals that happen in the brain, those things don't function well. They become disruptive. And this leads to a physical change in the body, and it can change your behavior as well. Now, when these symptoms significantly disrupt your life, you'll find that you'll have difficulties in thinking and problems with focusing. Perhaps you'll have extreme emotional highs and lows, or even sleep disturbances. Those are often the first thing that you see. And when all of these things are in place, we say that the person has a mental disorder. So when these things disrupt a person's life, what we've talked about, it's a mental disorder. And it's very important to note that there are some people with mental illness that can get help and some can't. There are some that can keep a job and some can't. Some can't eat, some can. Some self-harm, some don't. Some are suicidal, some aren't. Some take medication, others don't. It's different for everyone, but it's still valid. In fact, if you grew up in a dysfunctional home, you probably thought that it's okay to forgive and forget and never change your behavior. Maybe you thought it's okay to move on as if nothing happened. It's called the white elephant, or in the room, or sweeping things under the carpet, covering up problems for others, denying that a problem exists, keeping secrets that actually need to be shared. Maybe you pretended that it was fine, that it's okay not to express your emotions. Being around harmful people, becomes normalized. Thinking that aggression is how you get what you want. All of these are signs that it's dysfunctional. None of these things that I just mentioned is normal. So today I hope to challenge your perception of what is normal and open up your mind to perhaps a new normal, something that is healthier. So I cannot stress enough that mental illness is most commonly present since childhood. And it extends into your adolescence and into adulthood. But most of the adult diseases, because parents did not seek help for their children or failed to follow through with therapy. And we find that the most common childhood mental illnesses are ADHD. I'm sure you've all heard of this. Generalized anxiety disorder, autism, children that are on the spectrum, and it's a very wide spectrum. And then in adolescence, from these three most common core mental illnesses in a child, it comes into adolescence and it's presented with depression, bipolar mood disorders, schizophrenia, eating disorders, panic disorders, addiction, social anxieties, the list just goes on, and OCDs. So the most common ones that we see, and the ones that I'm going to discuss in very brief detail, is bipolar mood disorder. This is also known as an affective disorder, and it involves these persistent feelings of being high or being low. So it's a high mood or a low mood. So you're overly happy and with a fluctuation of being really sad. And then you've got depression, which is sadness and grief, loss, and anger that interferes with your normal life. Then there's ADHD, which is a combination of persistent problems like paying attention, hyperactivity, always being impulsive, not being able to control your impulses. Then schizophrenia, which is a little bit more complex, because this involves how you think and what you're aware of. And it's characterized by hallucinations and delusions, things that are not there, but you believe are there. Then there's post-traumatic stress disorder, which occurs after a trigger, a stressful event. And then, of course, the neurological and endocrine disease. And they are very common. We find that, people that are hypothyroid or hypothyroid, epilepsy, stroke, dementia, all of these things can manifest as mental illness. So I just want to spend some time looking very briefly at some of these disorders. The first one is affective disorder. This is bipolar mood disorder. And it's also known as manic depressive illness, with recurrent episodes of mania and depression at different times. So it is a disorder that affects a person's brain, which causes their mood to frequently and uncontrollably change. And it's so serious that it can damage relationships. It can lead to unemployment, poor education, cannot keep jobs. And oftentimes the serious depression can end in suicide. So critical to this disease, and it's very important to note that it has a strong genetic component. 75% of patients with bipolar mood disorder have a parent that has had it, maybe undiagnosed and not treated. So when we look at the two spectrums, you've got the manic phase and you've got the depressive phase. And in the manic phase, when a patient is having a manic episode, they have these high moods. Think of the ultimate high. Think of the highest high you've ever had. And when there are 3 or more of these symptoms that last from 1 day to 3 to 4 months, we call it mania. And these symptoms include increased energy, being very restless, an excessively euphoric mood, becoming highly irritable, racing thoughts, talking really fast, and they're jumping from one idea to the other, and they can't string a sentence along, poor concentration, very little sleep, unrealistic beliefs in their ability or their power. You find a lot of them think that they're superheroes. They show signs of poor judgment, poor critical thinking, maybe an increased sexual drive, and often they end up, indulging in alcohol and illicit drugs. So that's somebody who's manic. And then on the opposite pole, you have somebody who's depressed. And when they have 5 or more of the symptoms I'm just going to illustrate now, that lasts for a day, for nearly every day, for most of the day, for more than 2 weeks, for 4 to 6 months, we say that this person has depression. And this is the feeling of this lasting sadness, anxious, an empty mood, feeling hopeless, filled with guilt and worthlessness, loss of interest in pleasurable activities and things that they enjoyed previously, a difficulty concentrating or remembering or even making a decision, too much sleep or too little sleep, weight loss. You find that the weight fluctuates, thoughts of death and suicide attempts. This is somebody that would be in the depressed phase. And you see that between 5 to 15% of people that struggle with this disease become rapid cyclers, which means they go from mania to depression, and it happens more frequently. And 10 to 15% end up committing suicide, and 70% end up using substances to cope. This is a highly challenging disease. It's very difficult to treat. And often the patients go through the cycle of they're in a crisis, and then it's managed, and then they recover, and they feel that they're free, and they're stable, and they've mastered themselves in a certain aspect of themselves, and then they think they're okay, and they stop their treatment, they stop the therapy, and they relapse. And the relapse might not be as serious as it was before, but you'll see, and we'll discuss later on now why it's so important that you always keep those checks in place once you have changed your lifestyle. But this is easily treated. There are mood stabilizers, they're good drugs, but it's very important for us to ensure that if you're supporting somebody that has bipolar, or you yourself has it, that you have enough structures in place. The second one I want to talk a little bit about is major depression. So this depression is different from bipolar because it's unipolar. So someone with major depression doesn't have an up phase. So that's how we will know the difference between bipolar and depression. So depression, it impairs your cognitive flexibility. It changes your thinking, your feelings, so that you cannot see a way out of your current state of mind. You can't envision a future of feeling better. Can you imagine what that feels like? Where everything is so completely hopeless. And what happens is, in this disease, your perception of pain is magnified. And I'm not going to go through all of the symptoms that we just discussed before, because it's the same as it is with bipolar. I'm going to talk a little bit now about suicide, about being in that really dark place. There's something you must remember when it comes to somebody who's depressed or thinking of ending their life. They do not want to end their life. They actually want to escape mental and emotional pain. They are in a cycle of endless rejection, endless negative thoughts, constantly reliving failures and defeats, enduring this constant self-recrimination, envisioning only bleakness and sadness and blackness. Someone who wants to kill themselves doesn't want to end their life. Don't judge. I don't know how many of you know people that have attempted suicide or even done it. It is not for that reason. It's because you got to understand that they were in so much of pain. And I'm a suicide survivor. I attempted suicide when I was 19 years old. You would think that, I had the perfect life. I was in medical school. And I entered into a pit that I could not get out of. And as a medical student, you know how to kill yourself. It took me 20 minutes to drink 100 paracetamol. That was almost 5 times the fatal dose. To make sure that I was really going to die, I slit my wrists. And I remember lying there, unsuccessfully trying to slit my wrist. And I screamed out at God and I said, if you don't show up for me today, I'm coming to you, whether it's in heaven or hell. Because I was in such a place that I could not get out of it. Everything was just black. There was no hope. There was no positive voice. And of course he did. He showed up. An angel came in. It saved my life. I had my stomach pumped. It was awful. But I survived it. But I know what it's like to be in that place. Let's not judge. Let's not judge. You do not know what the person is going through. You see, rejection activates the very same area in your brain that causes physical pain. So if you were to pinch yourself now and it's sore, just remember that the pain that somebody that feels when they are rejected is exactly the same. But the difference is that with psychological pain, you end up in this endless loop from the brain. So that every time you are experiencing something, you are experiencing it in the same measure. As you recall it, it is as though you are reliving that thing again. And it's re-experienced over and over in all its acute emotional intensity. So if you're giving somebody the silent treatment, in fact, I'm quite convicted about this because my husband is receptive to the silent treatment often. It is actual physical pain. So when you reject your child, it is a physical pain. Amen. So some of the warning signs for suicide. You see, it's important that you don't dismiss the threat. Don't say, oh, there she goes again. She just wants attention. She only wants attention. That's why she's doing it. You've got to call for help. When a person starts talking about death, when you see that they are purchasing guns or knives or drugs, when they become withdrawn and they're showing a lot of despair, if somebody has previously attempted suicide, if somebody is preoccupied with death and they're making inappropriate statements like, oh, you don't have to worry about me anymore. Don't worry. Saying, I wish I was dead. Inappropriately saying goodbye. When they switch from a depressed mood to being normal for no reason at all. In fact, that is the most dangerous sign. For somebody who is seriously depressed and they look happy and they're not on medication, they've not been taking therapy, you've got to know that something is going on. So what can you do? You've got to have a safety plan. And this is for those, that are supporting someone who's depressed. Have a safety plan, discuss. There's so many experts around that can help you. Look for what, there are suicide prevention tables that you can implement in your home. You've got to be alert, communicate with the person in a loving way, show them support. But let me stress this. I know I'm stressing a lot of things, but let me stress this. If the inevitable happens and the one that you love ended their life, don't condemn yourself. That's very important because some people will show signs and others won't. You've done your best. There are 2 victims of suicide. It's the one who ended their life, and it's the one that's left behind to pick up the pieces. Let's not judge. Don't be critical. Support. The next thing I want to talk about, which is very common, that we're seeing so much of, is attention deficit disorder, ADHD. So this is a mental health disorder that includes a combination of persistent problems such as difficulty in paying attention, hyperactivity, impulsive behavior. Now, in adult ADHD, this leads to unstable relationships, poor work ethic, poor school performance, low self-esteem, and many other problems. And although it's called adult ADHD, it often starts in early childhood and it continues into adulthood. In some cases, you find that ADHD is not recognized until the person is an adult. And the problem with treating it as an adult is that the symptoms are very obscured. With the child, it's very easy to see, to spot the ADHD child in the crowd. It's the one that's bobbing up and down. It's the one, that cannot sit still. So it's easy to see in a child, but with an adult, that impulsivity and that restlessness and that difficulty in paying attention, it can continue, but they adapt over the years so that they can function. So there are lots of medications that are available and they work really well and it can actually change your life. ADHD is just so common. This is by far the one mental illness that has frustrated doctors, especially myself, the most. I've seen hundreds of children that had ADHD, but more often than not, it's the parent that doesn't want to admit that there's a problem with their child. And the story that just drives me, it triggers me to the point when they say, oh no, when you prescribe the Ritalin, my child is zonked out. It's because they've had a 5-year-old running around and being so disruptive for so long that when they see their child actually sit quietly and focus, they think, oh no, he's zonked out. The abnormal is what they considered the normal. And the normal child is now considered abnormal. And this leads to so much of problems. ADHD is the root of depression, social anxiety, anxiety disorders, generalized anxiety, social phobias. All of these things you find, this negative self-image. Why? Because of this electrical impulses that are just flying in the brain. That poor child doesn't know how to cope. And giving them these life-changing drugs actually takes the edge off it so that they can focus and do what they're supposed to do. But it's generally the parent. Parents refuse their children these drugs that will change their life. And the important thing to remember is that if you treat ADHD as a child, your child can outgrow it. But by the time they become adults, it's harder. But if you treat ADHD as an adult, and if you're sitting here with undiagnosed ADHD, it will really change your life. The drugs will change your life. You'll wake up one day and say, wow, it took me a week to do this, but I was able to focus and I got it done in an hour. And ADHD is a very common cause of procrastination. You procrastinate because you can't focus, because you can't get through what you're supposed to do. And then you have this feeling of being inadequate and you have a low self-esteem and just perpetuates the cycle. So treat it. Treat it and it will change your life. Schizophrenia. This is the tough one. Schizophrenia is characterized by this distorted awareness in thinking. It's characterized by delusions, hallucinations, disorganized speech and thought, negative symptoms, and disorganized behavior, sometimes catatonia. A delusion is a fixed, firm belief that a person maintains even though there's evidence to the contrary. One of the most common delusions you'll find is that somebody is paranoid or someone is trying to persecute them. And it involves this intense fear that follows this delusion. And as a result, your life changes because you really believe that someone is trying to kill you or someone is persecuting you. The hallucination is a perception, and there's no external stimulus for this. And what they feel is extremely real. So you can hear a voice, and so it's hearing these sounds that nobody else is hearing, seeing people and seeing ghosts or seeing demons or seeing dead people, and you believe that it's there. It's smelling things that are not there. It's feeling things that are not there. And sometimes it's somatic. Many people will come to the doctors, and for the doctors out there that are that are open to fraud and all sorts of things, and just want to make extra money, this patient becomes a best patient because you can investigate. You can take that patient to every possible test, and everything comes back normal. And they're still looking for that. Why do I have that stomach pain? They become a hypochondriac. Because the feeling is so real, they don't realize that this is actually a mental illness. Then, of course, there's the disorganized speech or thought. I don't know if you've ever had a conversation with someone and you had absolutely no idea what they were talking about. You might have actually witnessed somebody having disorganized thought. They'll talk about the bird, they'll talk about the car, then they'll talk about what they ate the other day, and then they'll just randomly change the subject. And you find that what they say, they go off on a tangent so quickly, and it's usually so irrelevant to what you're talking about. Constantly beating around the bush, not getting to the point because they've forgotten the point. They're jumping from one thought to the other. And you find that when they have this abnormal way of talking, this is actually the evidence of thought disruption. And then, of course, we can get the disorganized behavior or catatonia. I remember this incident when I was a little girl and my dad was called out to cast the demon out, and he used to take me to cast out all these demons. And so I went there, and there was this girl, and she was lying there, and she was just completely catatonic. And they were trying to cast out this demon, and this child was just lying there. And eventually this child ended up going to hospital. I don't really know what happened. I'm thinking maybe that child was schizophrenic. Maybe that child had an epileptic attack. And it was just the thought that, if anything was happening, that it had to be a demon. So you find when a person behaves in this bizarre way, maybe they act very childlike and silly. Maybe they get easily lost, or they're confused. They stop caring about themselves. You find that that's how most schizophrenic end up, not caring about themselves. They look unkempt. They do bizarre things. They talk to themselves. They hear things. They believe things. They are socially inappropriate. And when it comes to catatonia, they are completely immobile. They have absolutely no awareness to what is going on around them. They might even become mute. And then, of course, there's the negative symptoms. And this refers to the absence of usual or expected behavior. The most common one is a person has absolutely no emotion. You see that sometimes in people who are severely depressed. I don't know if you've talked to somebody and their face is just blank. And it feels like there's a mask and you can't get beyond them. You make a joke and they just look at you. And they speak in this monotone voice. But somebody who has a flat effect, like in schizophrenia, it's a complete mask. And then you find that they are unable to actually process thoughts. So there's alogia, which means that whatever you say goes over their head. They have this distant stare where they just look and they just gaze, and you have no idea whether what you have said has reached them. And then, of course, the person has no ability to actually react, to do anything. So there's an extreme lack of motivation. But, this is what I say about this disease, schizophrenia. It is by far the hardest disease to treat. It is the most intelligent mental illness. It's hard to treat. It's hard to diagnose. It is extremely evasive. It's extremely debilitating. And it's extremely common. The thing is, you don't actually know how to support the patient. And if you do not know how to do that, you will end up feeling hurt and injured and broken by this person. Because it is such an intelligent disease, the person can function normally. And they have a job, and they have, they can be married, they can have children. And you would think that this person is completely closed off to you. The delusions and the hallucinations are so realistic. They build the story up so well that you can also get entrapped in it if you do not know what you're dealing with. And that's why it is a very difficult disease to treat. So, and the last one I want to look at is post-traumatic stress disorder. You see, majority of people after a traumatic or distressing event, like a car accident, a hijacking, COVID, looting, flooding, you find that there will be some change. But these changes are normal. These are normal psychological stresses, and these things improve over time, but not everybody will be traumatized by those events. The majority will be distressed, but only a small number will become chronically traumatized. So everyone reacts differently to risk and to stresses out there. But all of the symptoms of PTSD, the mental illness, all of them, they end up presenting with anxiety, depression, phobias, insomnia, but they can be linked to a specific trigger. So this is a condition that occurs after a traumatic or a terrifying event. And people with PTSD often have lasting and frightening thoughts and memories of that event. And, they can also become emotionally numb. And the thing that's tricky with PTSD and your mind is that you can take it and you can bury it. And you bury it so deep inside. And then suddenly you're having palpitations. And suddenly you're having chest pain. And all of the results are coming back fine, but you don't realize there was something actually buried really deep, and it takes intense psychotherapy to get to that diagnosis. So the last one is if there's a neurological or endocrine disease, these are easily treated. You see that 60% could have a neurological cause. That's something that is in the brain, that's organic disease in the brain. And 40% is endocrine, and these are very easily treated. But people don't get help. And there are many reasons for someone not getting help, from affordability to they could handle it on their own, or they don't know where to go, or there's no time, the stigma, maybe your medical aid doesn't cover the cost, all the way, fear of lifelong drugs, stigma, fear of being committed, to all sorts of reasons people have for not treating, for not seeking help. But for me, as a doctor, I am less concerned with what your brain thinks is happening. I'm less concerned with your opinion. I'm more concerned with what your body knows is happening, with the signals that your body is giving you, that you would be suppressing or ignoring. Your body is a much better indicator than your opinion. I'll say that again. Your body is a much better indicator than your own opinion. Now, this brings me to the most important part of my presentation. If you forget everything that I've said before, that's okay. You can forget it. That's okay. There are many experts out there that know all this stuff and they can help you. This is the part I really want you to catch. There is no cure for mental illness. You see these percentages here that you're seeing, these are percentages for improvement rates if you take lifelong medication. So if you have bipolar and you're on treatment for lifelong, there's only an 80% chance that you will be cured. Well, not cured, that you'll have a treatment success. 80% with ADHD, 60% with schizophrenia, 40% with PTSD, 48% with anxiety, 50% of OCD people are not cured. 50% of people that have phobias, treatment doesn't work. Panic disorder, 24%, others 25%. This is staggering. This is scary. And why is there no cure? After so many years of medicine and science and research and information out there, and of course, so many mentally ill people walking around, why don't we know this? Why? What's missing? What is missing? And so I tried to figure this out. And I couldn't. And I read thousands of articles. And I've spoken to all of my friends that are experts, that are in this field. And in fact, most of my friends who are psychiatrists are schizophrenic themselves. They're on treatment themselves. One of my friends actually attempted suicide. And she's a psychiatrist. Why? What is missing? So I had to go to the source. The source is the Holy Spirit. He's the one that has the answer. So I have an answer. You want to hear it? Okay. So let's use a case study. Case study is always better. So there is a 16-year-old boy, and he lives in a rural area. Parents are illiterate, and they live quite isolated. And he has aphasia. Now, aphasia means that he's unable to speak, but he can groan, he can cry, but he doesn't have any hearing loss. Okay, so he's mute essentially. He has seizures from childhood, but he's currently not on any treatment. So these are typical seizures. I don't know if you're aware of what seizures are, but it's the jerking movement. It's called a convulsion. There's frothing at the mouth. His seizures last for more than 2 minutes, which is a very long seizure. Often he injures himself. And when he's around people and crowds, it triggers a seizure. And he's had several suicide attempts. He attempted drowning. And he also threw himself into a fire, trying to burn himself. So his parents went to the local clinic. He was diagnosed with epilepsy and aphasia, and he was given anti-epileptics. They advised him to stay at home, be homeschooled, and to avoid people because that is a trigger. Then the father took him to traditional healers, and they advised him that this was an evil spirit. So he stopped all treatment and he started using several traditional remedies. And then he got saved and he came to the pastors. And the pastors concurred that this was a demon. So there were multiple failed exorcisms and there's no family support. What do you think about this? Is this a demon? Is this a mental illness? You can talk to me. What do you think about this approach to this child and this family? Do you agree with this? How many agree? Show of hands. Agree with this, okay? How many don't agree? Okay. So let's look at what should have happened, okay? So we don't know. We know that there might be a neurological cause, okay? We're not sure if this is a demon. He has epilepsy. He has aphasia. He probably has major depression because he's been attempting suicide. He could be autistic, somewhere on the spectrum. He could have had cerebral palsy. Maybe he was born at home and didn't have oxygen when he was born. So the way we would treat is you need to have a multidisciplinary approach. Isolation, do you think he should be isolated? No. Should he be condemned? No. We need to investigate. He needs some bloods, maybe some CTs, MRIs. He needs to be on the correct dose of medication. He needs therapy. He needs to be educated. So this is how we would treat this child. And when you think about what he got, he didn't reach a cure. But I'm going to show you how this child was actually cured. You want to know how he was cured? It's actually from the book of Mark, chapter 9, from verses 14 to 29. It's also seen in Matthew and Luke. And I've put all the verses together so that it actually makes sense. It says, you can read up on the screen. It happened on the next day when they had come down from the mountain that a great multitude met him. And he came to his disciples and he saw a great multitude around them and the scribes disputing with them. Immediately when they saw him, all the people were greatly amazed and came running and they greeted him. So he asked the scribes, what are you discussing with them? Then one of the crowd came to him, kneeling down, answered and said, Teacher, I brought you my son. He has a mute spirit. He has aphasia. Lord, have mercy on my son. I implore you, look on my son, for he is my only child. He's an epileptic and suffers severely, for he often falls into the fire and often into the water, tempted suicide. And behold, a spirit seizes him. Suddenly he cries out, convulses so that he foams at the mouth, and it departs from him with great difficulty, means that it's lasting more than 2 minutes, bruising him, causing him pain. Now, whenever it seizes him, it throws him down, he foams at the mouth, and he becomes rigid. So I brought him to your disciples and spoke to them and implored them to cast out, but they could not cure him. And he answered them, O faithless, perverse generation, how shall I be with you? How long shall I bear with you? Bring him here to me. And they brought him to him. And when he saw him, there's the trigger. Immediately the spirit convulsed. He fell on the ground. He wallowed, foaming at the mouth. And so Jesus takes the medical history and says, well, how long has this been happening to him? He says, from childhood. He says he's often thrown him both into the fire and water to destroy him. But if you can do anything, have compassion on us and help us. And Jesus said to him, if you can believe, all things are possible to him who believes. And immediately the father cried out and said with tears, Lord, I believe, help my unbelief. When Jesus saw that the people were coming, he rebuked the spirit, saying, deaf and dumb spirit, I command you to come out of him and enter him no more. Then the spirit cried out, convulsed him greatly, and came out of him, and he became as one who is dead, so that many said he is dead. And the child was cured from that very hour. But Jesus took him by the hand, lifted him up, rose, and gave him back to the Father. And when he had come to the house, his disciples asked him, why couldn't we cast it out? Jesus said, because of your unbelief. For assuredly I say to you, if you have faith as a mustard seed, you will say to this mountain, move from here to there, and it will move, and nothing will be impossible for you. However, this kind does not go out except by fasting and prayer. Now, in this narrative, in this story, there are many perplexing things that requires a deeper review. Do you agree that this case is very similar to the case study that we just discussed? Okay, so there are things here that we need to look at. This is not a straightforward case for consideration. So here's Jesus, here's the background. He was just transfigured on the mountain, and he comes down the mountain and he's greeted with this heated debate between his Pharisees and his disciples, who are on the edge of this fist fight. And when Jesus inquires about what is the cause of this argument, a man steps forward and he confesses. And he said that he brought his son for healing to the disciples, and the disciples and the Pharisees had failed to heal him. So it's very interesting to note that he confesses that he has a medical diagnosis of epilepsy and a spiritual diagnosis of demonization. So this solves a very important mystery. This is the mystery to the very sobering cure rates for mental illness. You see, when someone has a mental illness, they are not of sound mind. This would mean that they are open to demonic influence. You see, someone with a mental illness is an open playing field to the mischief of demons. It is an open playground for demons to run amok and insert ideas and thoughts and ideologies and show things and feel things and experience things that are not from God, that are not real. So therefore, every one of us should strive for a cure for every person that is suffering with a mental illness. You see, the burden of mental illness is not only to the family, it is to the community. And we've got to get involved because we don't want a society of degenerates, people that cannot function in our community. So this child had multiple pathologies. One was physical and one was spiritual. Now, the next interesting thing to note is, why did the disciples fail to cast out the demon? And here you see that Jesus ascribes it to lack of faith. But I think it was more than that. Consider this. Jesus says, because of your unbelief, but in verse 21, he says, however, there's a but in his answer. And we all know that when a but occurs in an answer, the first part of the sentence is not congruent with the second part of the sentence. So he said this kind only comes out with fasting and prayer. But curiously, Jesus absolved the disciples from fasting and prayer, because when the Pharisees came to him, he says, the disciples of John and of the Pharisees are fasting. Why did the disciples of John and the Pharisees fast, but your disciples don't fast? Jesus answered and said, well, when the bridegroom was with you, there's no need to fast. And he just said this in Mark chapter 2, just before this. So Jesus absolved them from fasting. And Jesus was also very specific in how they should pray. He didn't instruct them to pray for the sick and to pray for demons to be cast out. He appointed the 12 that they might be with him, that he might send them out to preach and have power to heal sicknesses and cast out demons. He gave them all the authority to just do it. So why does Jesus say this? It's a very curious thing. And then it made me think of my daughter. I won't tell you which one, but I think if you look at them, you'll know who I'm talking about. When she doesn't eat her lunch, and she comes home, and I see that box is there, woke up early in the morning, sacrificed, made her, cut up the fruit and cut up the veggies and made that sandwich. And it was well balanced. It was enough, a perfect amount of protein to carbohydrate. Yeah, it comes home and it's untouched. She says, Mom, I have a headache. I'm like, it's because you didn't eat your lunch. She says, Mom, my eyes are blurry. I'm like, yeah, because you didn't eat your lunch. Mommy, I have a pimple. Yes, because you didn't eat your lunch. Mommy, I fell down the stairs. Yeah, because you didn't eat your lunch. Mommy, I'm having bad dreams because you didn't eat your lunch. And I blame everything on the lunch, and then eventually like, oh yeah, okay, there we go again. But yet, there is a reasonable explanation. And I could, if I was, if I had the time, tie in not eating the lunch with why she fell down the stairs. If she got hypoglycemic. I believe that Jesus was actually really irritated. Just like how I get irritated with her for not obeying my instructions. You see, Jesus comes down from the mountain, he's transfigured, and there's his disciples fighting with the Pharisees. Because a man brings this boy, and the Pharisees are watching, so here they are trying to cast the demon's not going out. So they lost their confidence, they lost their faith. And so they come and say, why couldn't we do it? Because you don't have faith. But anyway, it's also because this kind comes out from fasting and prayer. But he doesn't qualify who. Who's supposed to fast? You see, there's a deeper thing at play here. And this, I'm coming to the point of that 50% cure rate. The disciples didn't understand dual pathology. You see, mental illness requires a different form of healing. Jesus took a medical history during a seizure. Jesus asked, how long has this been going? Where was he born? Did he cry when he was born? He's asking him questions. So the text doesn't say who's supposed to fast and pray, but Jesus illustrates it in the way that he delivered the boy who is supposed to have faith. The faith illustration was an add-on to what Jesus was saying to the Father. And the Father says, can you heal him? Jesus said, only if you have faith. He said, Lord, I believe. Help my unbelief. You can believe, but your unbelief can completely overwhelm your faith. You can believe you can get that healing, but when you give that first tablet and nothing happens, and the next day, and the next day, and you're walking the journey with this person that you love, your only son, your husband, your wife, you're walking this journey, that faith can become overwhelmed with unbelief. So you see here, hidden in plain sight, here in the scriptures, here's the answer to mental health. You see, in the old season, they only believed it was a demon. So they're casting out the demon, but then they were still left with the mental illness. The focus was on the demon. Nobody wanted the treatment. And then in secular medicine, the focus is only on the drugs and on the therapy and not understanding that there is also a demonic component. So you need both. To deliver and to bring cure, we need both. Jesus cast out the demon and the boy lay down there as dead. He had to be healed of another pathology. This was dual pathology. A person with a mental illness has dual pathologies. You've got to have compassion. Why? Because demons torment the mentally ill. The sounds in the mind, the pain that they feel, it is tormenting. So what? Why do we need faith to overcome mental illness? It's so that you can get 100% cure. For that pastor who committed suicide, who was depressed, thought it was a demon, he could do it on his own. He was so overwhelmed. There were two things at play. And this is the secret. And as a church, we've got to become relevant. So if you're not sure whether someone you know is living with a mental health problem, if you know somebody that is experiencing one or more of these feelings for more than 2 weeks, it can be an early sign. Feeling anxious or worried, and it's constant and it interferes with life. And there's unexplained somatic symptoms. Maybe they're unhappy, sad, irritable. There's a lack of motivation, loss of interest, crying, emotional outbursts of anger and distress, sleep disturbances, either insomnia or sleeping too much, changes in weight, either increase or decrease, maybe a change in personality, being quiet or withdrawing, and suddenly to becoming psychotic or manic, smoking, drinking, using drugs more than usual, excessive guilt and worthlessness, where there's a change in behavior, either they're passive or aggressive, it could be a sign. So what can you do? There's lots that you can do. Refer, but stay connected. We need the drugs, but we also need doctrine, and we also need the mind to be reformed. Take your prescriptions. Remember, it's chronic. Establish routine, rhythm, routine, and boundaries. That's very important. Set goals. Goals give you help. Eat healthy, a well-balanced diet. Exercise. It releases all of those feel-good hormones. Sleep 6 to 8 hours a night. Challenge all of those negative thoughts. Positive confession and affirmation. Learn something new. Do something different. Take on new responsibilities. Help others. Connect with others. And we must fast. And we must pray. And we must increase our faith. And we must be in covenant. And we must have grace. And we need to stay in fellowship. We need to practice the table of the Lord. And you need to say every day, Lord, I believe, help my unbelief. Until all you do is believe. And there's no unbelief. But more than anything, it's important to be grateful, because the joy of the Lord is our strength. If you're depressed, be thankful. If you're sad, be thankful. If you're lonely, be thankful. If you're angry, be thankful. Be thankful in all things. Amen. So I thank you. Thank you, Pastor Ronald and Pastor Ralph, the whole team. Thank you for entrusting me to share on this platform. It's been my privilege and my honor. Thank you for your attention as well. Bye-bye.